what they're reading on the internet is to write down and to keep track of, to ask a genetic counselor, because again, some of the information may be relevant and some may not be relevant for them. The next question is, what factors do I need to consider when discussing hereditary concerns? So I think it's important to consider the age and gender of the person that you're sharing the information with. So for example, I just spoke with a woman who has 2 children who are in their early 20s. And she wanted to know whether or not she should be sharing this information with them, and she should be telling both of her children. And so one of the things that we talked about was, what would the kids do with the information? So what she ended up deciding was that she wanted to tell her daughter, because it was more likely that her daughter, would, consider this information in terms of family planning before perhaps doing prophylactic surgery, and that the daughter had a right to have that information, and that she wanted to wait a couple of more years for the son until he got married and wanted to share the information with him at that point. Now, some other women may choose differently. They may have said, listen, it's relevant for both of them, because, anybody who would be marrying her son, in terms of the genetic risk of passing it along, that the woman who he may be dating may want to have that information. And also in terms of his own screening, to have that information. So again, the point is, it's a very personal decision. I think Amber highlighted that.